Canine parvo or parvo in dogs is a common but dangerous viral disease. It mainly affects unvaccinated puppies between the ages of 6 and 20 weeks. However, canine parvovirus may also affect adult dogs who have not received their parvo vaccine or missed a booster. How does canine parvovirus spread? Parvo is so dangerous because the infection spreads quickly and easily among unvaccinated dogs without requiring direct contact. Parvovirus is resistant to many common disinfectants, can live indoors for at least 2 months, and can live outdoors for several years under the right conditions. A dog can contract parvo by ingesting virus particles. These viruses then spread to their ultimate targets, the intestines and immune system. An infected dog begins exhibiting signs within a few days. Because an infected dog can spread the virus before they exhibit signs, the disease can spread quickly. Which dogs are most susceptible to parvovirus? Any unvaccinated dog is vulnerable to parvovirus, but young puppies seem most at risk because they have immature immune systems. A puppy is born with short-term immunity, which they acquire from their mother, but this protection wears off after a few weeks. Parvo's window of opportunity opens between this time and before a puppy starts their vaccine series at around 6 to 8 weeks of age. An unvaccinated dog, or one who does not complete their vaccination series, is most susceptible to contracting parvo until they reach 6 months of age. Parvovirus is common in puppies born to stray mothers or in shelter environments. What does parvovirus do to a dog's body? Parvovirus attacks rapidly dividing cells, which include specific cell types in the intestines, lymph nodes, and bone marrow. Within 24 to 48 hours of first showing vague illness signs, most dogs develop a fever and bloody, watery, profuse diarrhea. They may also vomit, act lethargic, become dehydrated, and refuse to eat. Intestinal damage can cause resident bacterial populations to leak into the bloodstream, ultimately causing septic shock, organ failure, and death. Meanwhile, parvo attacks an infected dog's immune system, depleting their white blood cells and leaving the infected pet defenseless. How do veterinarians treat parvovirus? Parvo treatment options depend on the infection severity, and parvo treatment options depend on the infection severity and the owner's finances. Hospitalization usually results in a 90% higher survival rate and requires dedicated isolation ward staff and around-the-clock care. Intensive outpatient care may be an option for less severely affected dogs. Outpatient care requires the pet's owner to provide diligent care, bringing in their infected dog for daily clinic visits to receive fluids, injections, and tests. This care option usually results in a lower survival rate, an 80% survival rate. Treatments cannot eliminate parvovirus from an infected pet's body. Their goal is to reduce or prevent complications. Intravenous fluids, antibiotics, anti-nausea medications, gastrointestinal GI protectants, and supplemental nutrition are treatment mainstays. Treatment may also involve a plasma transfusion to boost the dog's ability to fight the infection. How can a pet owner prevent their dog from contracting parvovirus? The key to parvovirus prevention is to ensure your puppy receives a complete 3 to 4 dose vaccination series, starting when they are between 6 and 8 weeks of age, with the last vaccine at 15–16 weeks old. Parvovirus vaccines are widely available through general practice veterinarians, low-cost vaccine clinics, and community outreach programs. Your dog should also receive a booster dose 1 year after completing their initial series, and every 3 years thereafter. A naturally infected dog develops long-term immunity, but should still receive booster vaccines to ensure complete protection. If your puppy is too young for parvo vaccination, you must carefully protect them from virus exposure. Allow only known, trusted, vaccinated pets around your unvaccinated puppy. Do not take them to pet stores, dog parks, playgroups, or anywhere other dogs may have frequented until 1 to 2 weeks after they have received their first vaccination. 2 weeks after their last vaccination. However, since socialization is important during the puppy stage, your pet can interact with known, vaccinated dogs and puppies during the vaccination series. Help others aware by sharing the video.